You've seen them at gas stations, convenience stores, and all over social media, those little pouches promising a safer nicotine fix. But are they really safe? And do they actually deliver? Or are you just being fooled? I'm Dr. Adam, and I help men cut through all the noise of misinformation to take control of their health. And today we're diving deep into the truth about nicotine pouches. Are they a smart alternative to smoking, or just another marketing trap keeping you addicted? In this video, I'll break down how nicotine pouches actually work, their potential benefits and hidden risks, whether they really help you quit smoking, and then some alternatives that might surprise you. Okay, first, what are nicotine pouches and how do they work? Well, simply put, these pouches are tobacco-free sources of nicotine. They contain nicotine, obviously, some flavoring, and then some plant-based fillers like eucalyptus or pine fiber. And so instead of inhaling smoke or vapor, nicotine is absorbed through the lining of your mouth. So why are they becoming so popular? Well, there's no smoke, no vapor, no odor. They're legal to use indoors or on flights, and they're marketed as cleaner alternatives to cigarettes or vaping, which is all true. I recently went on a surf trip with a big group of guys, and I was surprised to see that almost everyone was using these pouches daily. While I knew they were popular in Montana, it's mainly because they're seen as a safer alternative for guys who used to smoke or chew tobacco. But the group of guys I was with on this trip had never had a cigarette or tobacco problem. They just started with the pouches. And that was surprising because why would you do that given how addictive nicotine is and given there are better options like caffeine? Because the big question around this is safety. So let's take a closer look. Because nicotine itself is not the same thing as smoking. So let me make that super clear. Because while smoking and vaping comes with pretty significant health risks, nicotine in isolation is pretty safe, especially in moderate doses. Nicotine is not a carcinogen. It's the harmful byproducts of smoking and vaping that increases cancer risk. However, and this is the part that most guys are going to hate hearing, but nicotine is super addictive, and that's because it quickly increases dopamine release in your brain, which reinforces habitual use. We know that. Then there's the mild concern that it also raises heart rate and blood pressure, which can be problematic if you have high blood pressure or if you just don't want your heart rate to increase, like if you're hunting. While nicotine alone isn't as dangerous as cigarettes, the big question is whether pouches are a smart way to consume it. Let's break down the pros and cons of nicotine pouches. So first, the benefits, because there are some benefits. You can use nicotine strategically for focus and motivation and cognitive enhancements, which is a hot term right now. It does increase dopamine and working memory and alertness, making it pretty useful for productivity. There's no smoke or tar, unlike cigarettes, so there's no cocktail of harmful combustion byproducts. And unlike caffeine, I guess nicotine doesn't cause jitters or digestive issues. Lower lung risk, since there's no inhalation. There's less social stigma, since there's no lingering smells or secondhand smoke. And then there's the possible harm reduction. So some people successfully use nicotine pouches to transition away from cigarettes or even prescription drugs like Adderall. And lastly, there's the neuroprotective benefits of nicotine, which could reduce the risk of Parkinson's disease and Alzheimer's. Now, what about the risks and potential downsides? Well, the main issue I have is that nicotine is one of the most addictive substances on the planet. So there's that. It's up there with heroin and cocaine and meth. If you ever wonder why it's so hard to quit smoking, that's why. It's not the tobacco that rewires your brain. It's the nicotine. Similar to those hardcore drugs that I mentioned. Are nicotine pouches healthier than alcohol and meth? Absolutely. But it's risky to use that logic to justify a harmful habit. So just because one substance might be, less harmful than the other, that doesn't mean it's safe or without some pretty significant risks. So nicotine, even in pouch form, is still addictive and can have long-term health consequences. We know that. So yeah, nicotine is not exactly meth, but it sure has a lot in common with it. And what I've seen in my clinical practice that's been, pretty alarming to watch is that nicotine can quickly become a crutch for guys when it shifts from a performance enhancer to a necessity for functioning at a baseline level. So here's how I've seen this unfold. There's 4 phases. Phase 1 is occasional nicotine use for focus. So this is how it starts. So let's say you decide to use 2 milligrams of nicotine before deep work sessions, maybe twice a week. You feel sharp, you're locked in and productive. So no big deal. And then phase 2 is this increased frequency. So a few weeks later, you start using it every time you need to focus. So not just for deep work, but for emails and meetings and all the minor tasks. You tell yourself stuff like, it just helps me get in the zone. And then you're in phase 3, which the baseline shifts. So now on days without the nicotine, you feel foggy and unmotivated and sluggish, and you struggle to focus. Then you have to use it to feel normal. And so your brain at that point expects the dopamine hit. And now you need it in order to perform at that level that used to come naturally. At that point, phase 4, full-blown dependence starts. So you begin using it multiple times per day, let's say like consistently morning, afternoon, and evening. You tell yourself things like, I'll cut back next week. But every time you try, you feel irritable or less focused or unproductive. Or you don't try to cut back at all because of the withdrawal symptoms, the mild anxiety, the fatigue, the cravings. It makes quitting harder and harder. And that's a red flag. A useful tool just became a crutch. So here's some other key signs that nicotine is becoming a crutch. Number one, you struggle to focus without it. You have to increase the dose over time to get the same effect. You use it reflexively instead of strategically every single day at the same times. Or you feel withdrawal symptoms if you skip it. Irritability, brain fog, low motivation, that kind of stuff. So there are also textbook signs of addiction, by the way. So here's how to avoid the nicotine trap. Number one, use it sparingly. So 1 to 2 times per week max. Pair it with natural focus enhancers, things like cold water exposure or walking in nature or even just deep breathing, mindfulness. And then you want to cycle off of it periodically to prevent dependency. So something like 1 month on, 1 month off. Or you could set some clear rules, some boundaries. So only use it before workouts or only before deep work sessions. The point is you remain in control. And look, I get it. Nicotine improves focus, but at what cost? I will acknowledge the benefits of nicotine for mental performance. We know that. But after doing the research for this video, I need to warn you against regular use due to the significant addictive nature of nicotine. But if a guy still chooses to use it, I recommend sticking with occasional low-dose nicotine gum or lozenges in the 1 to 2 milligram range rather than smoking or vaping or even pouches. And that's because nicotine pouches are safer than smoking. That's true, but not risk-free. They can help smokers transition away from cigarettes, which is by far their most useful benefit, but they don't fix addiction. That's a huge caveat. If you're looking for focus and energy, there's better options. And my compounds of choice are caffeine and L-theanine, which I think are better options long-term. So honestly, the healthiest decision, break free from nicotine for good before you become dependent and need it to function. Let's be real. If you're telling yourself that nicotine is not a big deal, that quitting is easy, then why do most people never actually quit? I'll leave you with that. All right. If you found this helpful, feel free to subscribe for more science-backed health content.